Please subscribe to my channel and do hit the bell icon. Hello to all dear students. In this video, we'll be discussing about dose adjustment for uremic patients. Dose adjustment for drugs in uremic or renally impaired patients should be made in accordance with changes in pharmacokinetics and pharmacodynamics of drugs in the individual patient. Whether renal impairment will alter pharmacokinetics of the drug enough to justify dosage adjustment is an important consideration. For many drugs that are eliminated primarily by metabolism or by biliary secretion, uremia may not alter pharmacokinetics sufficiently to warrant dosage adjustment. Not only drugs but even their active metabolites must be considered for additional pharmacological effects when adjusting dose of drugs. For some drugs, the free drug concentration may need to be considered due to decrease or altered protein binding in uremia. Even combination products that contains two or more active drugs in a fixed dose combination may be differentially affected by decreased renal function, and thus use of combinational drug products in uremic patients should be discouraged. Next we'll talk about basis of dose adjustment in uremia. So we know we have a loading dose and a maintenance dose. Regarding loading dose, the loading drug dose is mainly based upon the apparent volume of distribution of drugs in the patients. It is generally assumed that the apparent volume of distribution is not altered significantly in uremia, and therefore loading dose of drug is same in uremic patient as in subjects with normal renal function. Whereas in case of maintenance dose, this maintenance dose is mainly based upon the clearance of drug in the patients. In uremic patient, the rate of renal drug excretion has decreased and leading to decrease in the total body clearance. Hence, it requires dose adjustment. So, most of the dose adjustment assumes that non-renal drug clearance are unchanged. The fraction of normal renal function remaining in uremic patient is estimated by clearance, that is creatinine clearance method, and after remaining total body clearance in uremic patient is estimated, a dosage regimen may be developed by decreasing the maintenance dose or by increasing the dosage interval or by changing both maintenance dose and the dosage interval. So dose adjustment can be done by using either total body clearance method or by using elimination half-life method. Although total body clearance is more accurate index for drug dosing, the elimination half-life of the drug is more commonly used for dose adjustment because of its convenience. The clearance allows for prediction of steady state concentration, while elimination half-life method yields information on the time it takes to reach the steady state concentration. Next important thing is regarding the nomograms. These nomograms are charts available for used in estimating dosage regimen in uremic patients. The nomograms may be based on serum creatinine concentration, next upon the patient's data such as height, weight, age, gender and so on and so forth, and upon the pharmacokinetics of the drug. And one thing that you should remember is nomograms has errors in its assumptions and drug databases. Now first of all, we'll try to understand about how to use these nomograms. Now see, in uremia what happens? uremia is a renal disease, so renal excretion is affected, and so it is assumed that non-renal elimination of drug is not affected by renal impairment. So we have got KNR. KNR means non-renal elimination rate constant, which is not affected in renal impairment, whereas KR means renal elimination rate constant, and this is basically affected in renal impairment. Next, this KR, that is renal elimination rate constant in uremic patient, is directly proportional to the product of a constant and creatinine clearance. Okay, this alpha, it is a constant, and this thing to you know, that is creatinine clearance. Next, Ku, that is elimination rate constant in uremic patient, it is a sum of the non-renal elimination rate constant and renal elimination rate constant. So you can rewrite this equation as Ku equals to KNR plus, instead of Kr we can write the above equation, that is alpha, that is constant, multiplied by a creatinine clearance. So basically this equation can be used in the construction of a nomogram. So this is the equation and this one is a nomogram. In this nomogram, you can see on the x-axis is the creatinine clearance in ml per minute. That reflects the renal clearance. Okay, Kr equals to alpha into creatinine clearance. And on the x-axis, you can see uremic elimination rate constant in percentage Ku, which is the sum of non-renal and renal elimination rate constant. Next, apart from this, you can see drug A, drug B, drug C and drug D. 4 different drugs, each with different renal excretion rate constant. Now you can check out a pink box. The first point is the fraction of drug excreted unchanged in urine, that is Fe. Fe is a term for fraction of drug excreted unchanged in urine. For drug A, B, C and D are 5%, 50%, 75%, 90% respectively. Okay. So unchanged fraction means in urine means it is renal excretion. So this much amount of drug is excreted via the renal route. Okay. So drug A is 5% excreted via renal route. Drug B is excreted 50% via renal route. Drug C is excreted 75% via renal route, and drug D is excreted 90% via the renal route. Next, the creatinine clearance of 80 ml per minute equals to or more than 80 ml per minute is considered an adequate GFR in subjects with normal renal function. See, the uremic elimination rate constant, that is Ku, is the sum of non-renal and renal elimination rate constant. Okay. KNR, that is non-renal elimination rate constant, remains same as that of the normal person. But in uremic person, KR, that is renal elimination rate constant, decreases, because of which Ku, that is the uremic elimination rate constant, also decreases. Next, if the patient has a complete renal shutdown, that is when the creatinine clearance is equals to 0 ml per minute, then the intercept on the y-axis represents the percent of drug eliminated due to non-renal drug elimination route. Okay, so obviously when creatinine clearance is equals to 0, then the renal elimination rate constant equals to a constant multiplied by creatinine clearance. But creatinine clearance is 0, then Kr completely is 0. So elimination rate constant in uremic patient is equals to elimination rate constant for non-renal as well as for renal route. Okay, it is a sum of non-renal and renal elimination rate constant. But the value of Kr we got 0. Therefore, you can write Ku is equals to KNR. Next, as you can see over here, drug A is 5% renal elimination. Okay, so 5% of drug A is eliminated via renal route. That implies that 95% of drug A is eliminated via the non-renal route. Okay, so drug A is 95% eliminated via non-renal route, and you can see over here KNR is equals to Ku. So that's why the drug A is over here. Okay. 95%. Similarly, drug B is eliminated 50% via renal route. That means 50% eliminated via non-renal route, and non-renal elimination rate constant is equals to the total elimination rate constant in a uremic patient. So you can find the drug B 50%. Similarly, drug C is eliminated 75% via renal route. That means 25% is eliminated via non-renal route, and Ku equals to KNR. Therefore, 25% over here. And lastly, drug D, it is eliminated 90% via the renal route. That implies only 10% is eliminated via non-renal route. So you can find drug D over here. Next, drug D, which is excreted 90% unchanged in the urine, has the steepest slope and is most affected by small changes in the creatinine clearance. On the other hand, drug A, which is excreted only 5% unchanged in urine, that is 95% eliminated by non-renal route, is least affected by a decrease in the creatinine clearance. The nomogram method of Willing and Craig provides an estimate of ratio of uremic elimination Ku divided by to the normal elimination rate constant, that is Kn. That is, you can say Ku by Kn over here, Ku by Kn, on the basis of the creatinine clearance. And for this method, Willing and Craig provided a list of drug grouped according to the amount of drug excreted unchanged in urine. So from the ratio of Ku by Kn ratio, the uremic dose can be estimated by the equation uremic dose is equals to Ku divided by Kn multiplied by normal dose. So Ku stands for elimination rate constant in uremia, Kn elimination rate constant in a normal person. When dosage interval, that is tau, is kept constant, the uremic dose is always a smaller fraction of the normal dose. Obviously, the dosage interval is kept same, so obviously we need to reduce the dose of the drug. Instead of reducing dose for a uremic patient, the usual dose is kept constant and the dosage interval tau is prolonged according to the following equation. Okay, so we can even prolong the dosage interval, that is tau u, that is dosage interval in uremic patient is equal to Kn divided by Ku multiplied by tau n. Tau n is the dosage interval for dose in patient with normal renal function. Okay, so we have got two options. Either we should reduce the dose of the drug, or else dose means after reducing the dose of the drug, the dosage interval will be kept constant. Or else if you don't want to reduce the dose of the drug, then dose of the drug is kept constant, just we need to increase the dosage interval. Next we'll have a practice problem. Lincomycin is given at 500 mg every 6 hours to a 75 kg healthy patient. What doses would be used? A. In complete renal shutdown, that is creatinine clearance is equals to 0, and B. when creatinine clearance is equals to 10 ml per minute. Okay, so we have got dose, we have got dosage interval, we have got weight of the patient, and we need to calculate dose. Okay, as you can see over here, we need to calculate dose of the drug, and we have got two parts. In one part, the creatinine clearance is 0, and in second part of the problem, the creatinine clearance is 10 ml per minute. So under these circumstances, we need to calculate the dose of the drug. So for solution, there is a steps you need to follow to find out the dose, that is the uremic dose obviously. First of all, locate the group to which the drug belongs. So our drug is lincomycin, and we have got this table. So this table is provided by Willing and Craig, and we need to find out the drug. Our drug is lincomycin, and what is the group? The group is F. Okay, so this is the first step. First of all, you should find out the group, on which group that drug exists. Next step is find Ku divided by Kn at the point corresponding to the creatinine clearance of the patient. So you can see what is the creatinine clearance provided, the data provided in the problem. First creatinine clearance is 0, and in second part creatinine clearance is 10 ml per minute. So we have got this nomogram. On the x-axis you can see creatinine clearance. First the creatinine clearance is 0, in second part the creatinine clearance is 10 ml per minute. So you should find out which group of your drug is, that is F. Okay, drug F. So here you should find where the point lies. So you can get the value of Ku by Kn. Okay, so this is Ku by Kn wherever this point intercept. Okay, this point wherever it's intercept, that point will be like ABC, for example. Okay. Next, third step is determine Ku for the patient. So we need to calculate Ku. We have got the value of Ku divided by Kn from the nomogram. Next we need to calculate Ku. So we can use this table, and this particular column you'll get the value of Kn. So we have got Ku divided by Kn equals to ABC. ABC, the value we got from the nomogram, and the Kn value we got from this chart, and for lincomycin it is around 0.15. So same you should add, and Ku equals to 0.15 multiplied by ABC. ABC is the value what you got from the nomogram. Okay, so this is the third step, and the last step is make dose adjustment in accordance with the pharmacokinetic principles. So you need to add this, you need to use this formula: uremic dose equals to Ku divided by Kn multiplied by normal dose. So Ku value we got from the nomogram, Kn value we got from the list of the drug which was provided by Willing and Craig, and normal dose though we have 500 mg, that is the normal dose we have. So these are the ways by which we can calculate dose of the drug. So we will apply over here. First of all, locate the group to which the drug belongs. So we have got drug lincomycin and the group is F. The first step completed. Second step, find Ku by Kn at the point corresponding to creatinine clearance of the patient. So we have got first part of the problem when the creatinine clearance is 0. So you should locate, this is creatinine clearance at 0 and our drug is coming at group F. So it merely intercepts at the point 0.425. So we got the value Ku by Kn is equals to 0.425. Second step also completed. Third step, determine Ku for the patient. Okay, so you use this list of table provided by Willings and Craig. So group F, the drug is lincomycin, and over here you got the value of 0.15. So just for determining Ku, you should give Ku equals to 0.425 multiplied by 0.15. Very simple. So you will have a value somewhat like this, 0.0638 per hour. Third step also completed, and last step is make dose adjustment in accordance with pharmacokinetic principles. So uremic dose equals to Ku divided by Kn multiplied by normal dose. So you add the value of Ku, that is 0.0638, which we found in the third step. Then Kn value 0.15, which we got previous step, and multiplied by 500. So you will have a value somewhat like this, 212 mg every 6 hours. Okay, so in the problem it was given just dose adjustment, so we are just adjusting the dose. Nowhere it is given about the dosage interval adjustment. If dosage interval adjustment would have been given, then we should calculate accordingly. So first part of the problem completed. Next we have got second part also, that is B, when creatinine clearance is 10 ml. So you do accordingly. Locate the group. So we know the group lincomycin comes on the, under the group F. Second step is find Ku divided by Kn at the point corresponding to the creatinine clearance of the patient. So creatinine clearance is 10 ml and the group is F, and it merely intercepts at point 0.48. Next, find the value of Ku using the table provided by Welling and Craig. So that is 0.15. So very simple, Ku is equals to 0.48 multiplied by 0.15, we got the value of 0.072 per hour. Lastly, calculate the uremic dose. So just feed all the data whatever we got and just do the calculation. So we got uremic dose 240 mg every 6 hours. So this is the way how we will find the or how we'll solve the problem. Next thing is fraction of drug excreted unchanged method. So FE is mainly given the term for the thing for determining excretion unchanged, drug excreted unchanged. For many drugs, the fraction of drug excreted unchanged is available in the literature. Okay, so we have got a number of drugs, a list of various drugs with their FE value and elimination half-life value available. So this FE method, that is drug excreted unchanged method for estimating a dosage regimen in uremic patient, it is a general method that may be applied to any drug whose FE value is known. Next we have got Guisti-Heighton method, which assumes that the effect of reduced kidney function on the renal portion of elimination constant can be estimated from the ratio of uremic creatinine clearance to the normal creatinine clearance. So we can write it in this manner, where this is the uremic renal excretion rate constant and this is the normal renal excretion rate constant, which is equals to, this one is the uremic creatinine clearance and this one is the normal creatinine clearance. Okay, so let it be equation number 1, and you can rewrite it in this manner, that is the uremic renal excretion rate constant is equals to the normal renal excretion rate constant multiplied by the uremic creatinine clearance divided by the normal creatinine clearance, and let it be equation number 2. Because the overall uremic elimination rate constant Ku, it is a sum of renal and non-renal elimination rate constant. So you can write Ku equals to Knu, that is the non-renal elimination rate constant in uremic patient plus the renal elimination rate constant in uremic patient. And over here, in place of this, you should write this equation number 2. So you can rewrite in this manner, Ku, that is elimination rate constant in uremic patient equals to non-renal elimination rate constant in uremic patient plus this value. So this be equation number 3. Now in continuation with equation number 3, dividing this equation 3 by Kn, you can write it in this manner. Let it be equation number 4. Now let Fe equals to Krn divided by Kn equals to fraction of drug excreted unchanged in urine, and 1 minus Fe equals to KUNR divided by Kn, that is fraction of drug excreted by non-renal routes. Okay, Fe means fraction of drug excreted unchanged in the urine, and 1 minus Fe is fraction of drug excreted by the non-renal route. So Fe is written in place of KNR divided by Kn. So over here, in place of this we should write Fe, and in place of KUNR divided by Kn, that is this one, in place of this we should write 1 minus Fe. So you can write it in this manner. Substituting equation 4 yields the Guisti-Heighton equation, where G is the Guisti-Heighton factor, which can be calculated from Fe and the ratio of uremic to normal clearance. Okay, in this manner, or you can rewrite it in this manner also, and let it be equation number 5. So this Guisti-Heighton equation is most useful for most of the drug for which the fraction of drug excreted unchanged by the renal route has been reported in the literature. The ratio of Ku divided by Kn can be calculated from the fraction of drug excreted by the kidney from the normal creatinine clearance and the creatinine clearance in the uremic patients. Next we'll have a practice problem. The maintenance dose of gentamicin is 80 mg 6 hours for a patient with normal renal function. Calculate the maintenance dose for a uremic patient with creatinine clearance of 20 ml per minute. Assume a normal creatinine clearance of 100 ml per minute. So solution is, First of all, what drug it is? The drug is gentamicin. So check out over here, gentamicin. This is the Fe, this is the half-life. I'll zoom it so you can see over here. This is the Fe, this is the half-life. Okay. So we can use this thing, Fe. The value of Fe is 0.98, which is almost equals to 1. So using the equation, Ku divided by Kn equals to 1 minus Fe into 1 minus creatinine clearance in uremic patient divided by creatinine clearance in normal individual. So add the value. Fe is 1, and in this problem only you can see the creatinine clearance is 20 ml per minute, and assume the normal creatinine clearance to be 100 ml per minute. So we add all these things and we got the value of 0.2. Next, you use this thing, du by dn, that is dose in uremic patient divided by dose in normal individual is equals to the elimination rate constant in uremic patient divided by elimination rate constant in a normal individual. So add the value dn, the dose in normal individual is 80 and the value of Ku by Kn we got 0.2. So 16 mg. The maintenance dose is 16 mg for every 6 hours. Next, alternatively, the dosing interval can be adjusted without changing the dose. Okay, so we are keeping the dose same. We are using a normal dose. The normal dose is 80 mg and the normal dosage interval is 6 hours. But we can increase the dosage interval by using the formula tau u by tau n equals to Kn divided by Ku. So you can see over here, do not get confused. This is Ku by Kn and this one is Kn by Ku, this one is Kn by Ku and this is Ku by Kn. So you simplify it, tau u equals to tau n multiplied by Kn divided by Ku. So what is the normal dosage interval? That is 6 into 1 divided by 0.2, and calculating we got the time 30 hours. So you can say the patient may be given 80 mg every 30 hours. Next, we have got another practice problem. An adult male 52 years old and 75 kg whose serum creatinine is 2.4 mg per deciliter is to be given gentamicin sulfate for a confirmed gram-negative infection. The usual dose of gentamicin in adult patients with normal renal function is 1 mg per kg every 8 hours by multiple IV bolus injection. Gentamicin sulfate is available in 2 ml vials containing 40 mg of gentamicin sulfate per milliliter. Calculate A. The creatinine clearance in this patient by the Cockcroft-Gault equation method, and B. The appropriate dosage regimen of gentamicin sulfate for this patient in mg and ml. Now, this is a very big, so many words. So we'll simplify this thing. So suppose this is an adult male patient. What all values, what all data is given is age is 52 years old, weight is 75 kg, and it have serum creatinine level of 2.5 mg per deciliter. Next, normal dose is 1 mg per kg. So here the adult male patient weight is 75 kg. So accordingly the normal dose will be 75 mg. And the dosage interval is every 8 hours. So, and from the data whatever given is, suppose this is a vial, so it is available in the vial of 2 ml and 40 mg of gentamicin sulfate per milliliter. So these all are the data available. So what we need to find is A, that is the creatinine clearance in this patient by Cockcroft-Gault method. So we will write the equation which is somewhat like this, and we should add all the data whatever is available, that is age is 52, body weight 75, and serum creatinine is 2.4 mg per deciliter. So we will have the value of 38.19 ml per minute. So this is creatinine clearance. The first part of the problem is completed. Next, coming to the second part, that is B. The appropriate dosage regimen of gentamicin sulfate for this patient in mg and ml. So we'll use this equation, Ku by Kn equals to 1 minus Fe into 1 minus creatinine clearance in uremic patient divided by creatinine clearance in a normal individual. So the drug is gentamicin, and accordingly the Fe value will be 0.98. Okay, and creatinine clearance in the uremic patient, so what we got in our previous A bit from the Cockcroft and Gault equation is 38.19 divided by 100, that is creatinine clearance in normal individual is 100. This is because the value of the amount of drug excreted unchanged is 0.98, that is approximately equals to 1. So when the amount of drug eliminated unchanged means the amount of drug excreted via renal route is 1. So when the amount is 1 or the amount is 100%, that implies that the creatinine clearance in the normal individual should be 100% only. So for this reason, the creatinine clearance in the normal individual, we have written it as 100, and when we solve this thing, we will have the value of 0.39. Next, we need to find the dose. So uremic dose equals to Ku upon Kn multiplied by the normal dose. So we have the value of Ku, that is 0.39, and the normal dose is 1 mg per kg. So our patient is 75 kg, so the normal dose will for that particular person will be 75 mg. So we'll solve and we'll have the value of 29.29 mg. So give 29.25 mg or about 30 mg every 8 hours. Because the concentration of gentamicin sulfate solution is 40 mg per ml, 30 mg gentamicin sulfate is equivalent to 0.75 ml. So this is about the uremic dose. Next, dosage interval also we can alter. So tau u equals to Kn upon Ku multiplied by the normal dosage regimen, that is tau n. So Kn by Ku, so we should write 1 divided by 0.39 multiplied by 8. So we'll have the value 20.5 hours. So we need to give same dose, that is 75 mg of, that is a normal dose, and here the dosage interval will be 20.5 hours and not 8 hours. So this is how we can simplify this kind of problem. And this is how we will do dosage adjustment, either by reducing the dose or by increasing the dosage interval, and thereby adjusting the dosage regimen for uremic patients. So this is how we are doing the calculation. Apart from this, our very last thing is the Wagner method for dosage adjustment in uremic patients. So the various methods of dose adjustment in renal impairment we have seen so far, it assumes that the volume of distribution and fraction of drug excreted by non-renal routes are unchanged. These assumptions are convenient and hold true for many drugs. However, in absence of reliable information assuring the validity of these assumptions, the equation should be demonstrated as statistically reliable in practice. A statistical approach was used by Wagner in the year 1975, who established a linear relationship between creatinine clearance and the first order elimination rate constant of the drug in patients. This method takes advantage of the fact that the elimination rate constant for a patient can be determined, or it can be obtained from the creatinine clearance as follows, that is K percentage is equals to A plus B multiplied by the creatinine clearance. So where K, as you people know, that is total elimination rate constant, and this thing is creatinine clearance. Whereas this A and B values are determined statistically for each drug from pooled data on uremic patients. So this is about the Wagner method. The method is simple to use and should provide accurate determination of elimination rate constant for patients when a good linear relationship exists between elimination rate constant and the creatinine concentration. So this is about the Wagner method, and these were the various methods by which we can do dosage adjustment in uremic patient. I hope you people found this video helpful. Thank you for watching.